Start off by washing your hands, making sure that you are doing all of the different steps. First, introduce yourself to the patient, explaining what you would like to do, gain consent, and always asking if they are in any pain and if they require any analgesia before starting the wash. Always think about your back. Always making sure we have our correct equipment. We don't want to be running in and out, especially if our patient is naked. You would have your tiger bag. Please follow the waist guidance. Depending if your patient is infectious, you may need an orange bag. Then we have our Conti wipes. These are the wipes that we are using. Please make sure that you are not going into these wipes with contaminated gloves. We have 2 towels, one for dignity purposes and one for wiping dry the patient. Second, your patient may be incontinent, therefore we may need incontinent products. Your patient might feel comfortable wearing knickers. Please be aware of the sizing of these knickers. Sometimes they can really cut into your patient. And of course, making sure that if your patient has their own knickers or pants, then they should be wearing their own. Always remember how you're going to be discussing these topics with your patient. So gentlemen, they don't like to be called knickers, they might want it to be called pants. Blue squares, Inco sheets, procedure sheets, please do not leave these underneath the patient. These are very thin plastic with a tiny amount of cotton on them, so they are not absorbent whatsoever. So if your patient was to become incontinent on one of these, the moisture will just sit next to their skin and will macerate it. So please do not leave these underneath the patient's skin, and they are literally for quick, underneath the patient, 10-15 minutes, and then take them away. Have spare linen. We have 2 types of sheets. So this is our fitted sheet, and of course we have our non-fitted sheets as well. We have pyjamas here available at our hospital, but we would always like to make sure that if the patient has their own clothes, that they can wear their own clothes. Really, really encourage your patient to wear their own. Later on, we will be doing mouth care for our patient, but please follow the mouth care videos because there is clear guidance on exactly how to do that. Last but not least, our bowl, and I'm going to go get some water as well. Water up. Now, always be careful about temperature. You don't want it too hot, and you definitely do not want it too cold because that will be very uncomfortable for your patient. So if your patient is able, just see whether or not they are happy with the temperature, and also check with the patient to see if they have any of their own soap, their own products, and what they use on their skin. Do they have any emollients, anything that will help hydrate their skin? Because soap, it's very good for cleaning the patient, but it can dehydrate the skin. So always just double check with the patient as well. Decontaminate your hands, and if there is any chance of becoming in contact with bodily fluids, then wear an apron and gloves. Ask the patient if they have any jewellery that is causing them discomfort or any other items that they may not want to get wet. Always look out for glasses and also hearing aids as well. Check patient for ID badge. Start off by placing the towel over the patient's chest and under their chin. Ask the patient whether or not they like to use soap on their face. If not, just use water and wiping, starting off by their eyes and then going around their face. And then once you've completed that, place into the waste bin Next, clean the patient's ears. Then gently dry the face and the ears off. Wet or dry wipe, add any soap if required. Starting from the patient's chest, clean in their front. Wash downwards towards their hands, cleaning thoroughly and removing any dirt from underneath the patient's nails. Rinse off the soap and then dry. Always explain to the patient exactly what you would like to do and ask for permission. So a wash is an excellent opportunity to check the patient's skin, looking for any skin tears, bruises, and of course pressure ulcers as well. Therefore, it's really important that we should be removing TED stockings and non-slip socks as well. So always cleaning the patient's legs in a downwards way, and don't forget the toes. So our patient here has pillows underneath so that their heels are not on the surface of the bed. Now we are always looking out for signs of deterioration, for instance redness, so see whether or not your patient's heel is blanching. So press your thumb or one of your fingers into the patient's heel and see whether or not you can see where your thumbprint is. If you can, fantastic, that means it's blanching. If you can't and the area remains red, that means it is non-blanching. That could be a category 1. Good technique of putting the TED stockings on is putting them inside out and finding exactly where the heel is, because sometimes these are very, very tight, so it can be a bit of a struggle to put it on. So I've got the heel directly there. I'm going to place it over my patient's feet. Can be a bit of a struggle. If your patient has reduced mobility, you may need another member of staff to give you a hand. Consult the patient if they require a chaperone. If the patient has any property, place into a green property bag. Is making sure that we are going down and then never go down and then back up. We do not want to be transferring any feces back up to, especially on our lady patients. To clean the male genitals, start off with the tip of the penis. If the patient has a foreskin, retract it, clean it, then with a new wipe, clean the surrounding areas. If you can, lie the patient down, as it's easier to turn the patient on their side. Using warm soapy water, start off by cleaning the patient's back and the upper thighs. Always clean the bottom area last. Make sure you thoroughly dry the area. If you get contaminated gloves, stop what you're doing. Remove the gloves by pinching your non-dominant hand in the middle, taking it off, place it into the bin, going under, and then that way you're not going to be contaminating your hands. But always after glove removal, always make sure that you are decontaminating your hands. So either by soap or water, but you want to get back to your patient as soon as possible, so you might want to just use your anti-bac. Always check the patient from head to toe, toe to head, however you would like to do it, for all pressure areas including head, ears, elbows, heels, sacrums and even the coccyx. Discuss with the patient regarding their incontinence and place a pad if required. If possible, place knickers onto the patient, as this helps to keep the pad in place.
Check to see if the patient has any of their own clothes and ask if they would like to wear them. If your patient has an IV going, do not disconnect. Wait until the IV has been completed, or if you can, try and thread the IV through the sleeve of the clothing. Only an IV trained nurse can disconnect an IV. To change the bedsheet, it's easier if the patient's not in the bed, but if they are, roll your patient on their side, roll up the old bedsheet to the middle of the bed and place a new bedsheet on the middle. Then you can roll the patient over and change it from the other side. Always place linen directly into the linen bag, never put it on the floor. Once the wash is done, have a conversation with your patient and discuss which position the patient would like to be in. The ideal is to have the hips positioned at the fold of the bed. Therefore, if you were to sit the patient up, they would be in the upright position and not slouched down. Never talk over your patient, always involve them in your conversation. Always remember you're moving and handling when repositioning a patient. Place a pillow at the top of the bed so that they don't hit their head if you're moving them up. If the sliding sheet gets soiled, dispose of it. If not, then store it close to the patient's bedside, either underneath their mattress at the end of the bed or in the patient's bedside table. If your patient has an area of deterioration, try to reposition that patient off of that area. Always consult with your patient if they are happy with this.
Please do not discard wash water down your hand hygiene sinks. If you do that, you're going to pour it down, it's going to splash, and bacteria absolutely love a wet environment. So it will thrive in this area. So what we want to do is keep this area as clean as possible and only for hand hygiene.
Always dispose of the waste bowl into the macerator, removing any wipes or soap. Remove PPE and wash your hands. After the wash, clean the patient's environment, making sure that there is water available for the patient and that their cool belt is in reach as well.